There is a procedure that has been around for a long time that is now making it possible for men to return back to work and to regular duties. And thanks to the Prostate Cancer Institute and Dr. B here with us, we're going to talk a little about this procedure. But first, let's talk about what you do, of course, at the Institute of Arizona.
Yes. So I am a radiation oncologist that specifically focuses on a specific treatment called low-dose rate prostate brachytherapy. And this is for men with localized prostate cancer.
Yeah, and it's very important that people understand there's a lot of different procedures that go into, of course, taking care of prostate cancer. Yours is more for those who get this taken care of sooner. Is that kind of what we want to say?
Yes, when the prostate is contained in the prostate, not spread outside to other organs.
Got it. Okay, and I know we got some questions here to talk about, and I know you're ready to answer these because these are some questions that people have. And so let me talk about the first one. Who are the candidates for this?
Yeah. Typically, the majority of men with localized prostate cancer are candidates for this procedure.
Oh, wow. That's it. So that's the way it goes, and so where you can help them. All right, so what are some of the advantages of this procedure for people?
The advantage of this procedure is that it's a one-time treatment done in less than an hour. You go home the same day with minimal downtime and minimal side effects. And actually, the best erectile function preservation rates.
Yeah, and that's what kind of like scares men about going and getting talked about or doing this. They're worried that it's going to affect them in a lot of different ways, as you said right there, is intimacy or different things like that. And that's where you walk with them and talk with them. So let's talk a bit about, of course, what is involved with this treatment.
Yes. So the treatment starts actually the night before, where we actually do a bowel prep to clean out the right, like you would with a colonoscopy. And then the next day, you go to the hospital and we put you to sleep under general anesthesia. And the entire procedure is done under image guidance using an ultrasound that's placed in the rectum. Again, this is not a surgical procedure. We do not use any cutting, no needle, no knives, no opening up the prostate. The main way that we use this treatment is actually placing needles in the perineum, which is actually the area between the scrotum and the rectum, or otherwise called the taint area. And these needles are placed under the ultrasound guidance throughout the prostate, and then I inject the radioactive seeds under the ultrasound guidance through these needles, and then in the prostate, and then I remove the needles, leaving the radioactive seeds permanently implanted. That's slowly giving off the radiation, eradicating the prostate cancer.
Okay, all right. And so that after all this is done, what should people expect to, of course, feel after the procedure?
Yeah, right after the procedure, people are generally a little tired from the anesthesia and maybe sore in the bottom area, but most go home walking on their own from the recovery room.
So, and there's side effects with this procedure?
Yeah, there are short-term and long-term side effects with brachytherapy and with any radiation treatment. So with the short-term side effects, it's mainly affecting the bladder and urinary function. You could notice having to go more often to the bathroom, like with urination, maybe some burning, maybe a little bit more urgency to go to the bathroom, but they subside within a few weeks as the radioactivity of the seeds decay and wear off. The side effects wear off.
All right, and then of course men always wonder about the intimacy after all this is done. It worries them.
You can maintain sexual activity throughout this treatment.
Wow.
Yeah, like I said before, it has the best rates of preserving erectile function.
And one thing that you want to bring to light is that this is something that has been done for many of years. It just kind of like got pushed to the back burner, right?
Yeah, but we now have some modern advances to this. Okay, one modern technique that I use is called real-time planning. Traditionally, we would create a radiation plan on previously what we call a pre-plan based on prior images of the prostate, but I actually perform a radiation plan right there and then based on the current images of the prostate, and that really allows for the maximum precision.
Yeah.
You know, another big advancement is the use of rectal spacers. This is actually a big deal because the rectum can get damaged for radiation, and so now we can use these fillers to actually create the space between the rectum and prostate to prevent radiation damage to the rectum. It's actually interesting. It's actually the same filler that women use for cosmetics procedures for their face. But now is actually being used to create the space between the rectum and prostate to protect the rectum.
Yeah. And this is why you're asking men to come in, sit and talk with you, because again, we don't talk about this stuff when we need to more, and this is also about preventing and talking when you understand what the procedures are, helps you more understand what's going on with yourself.
Yeah, I think there is a big fear of prostate cancer. And yes, getting checked earlier definitely helps with a better outcome, but also understanding all their options. That it's not always, there could be other options for them, such as this, that could make it easier on their life.
Yeah.
And doesn't, and so they can still go to work a few days later. And still maintain sexual activity, can still maintain their quality of life. So it doesn't have to be what they perceive to be down and out.
Yeah, there it is. Doctor, I'm so glad we're talking about this. I'm so glad you're part of our Live Well, of course, with the station. And you can go to the Live Well site and you can see everything the doctor talks about and find out more about the Prostate Cancer Institute of Arizona. So, Dr. B, thanks for being here.
Thank you.
It's always a pleasure. So.